Hi, my name is Izzy. I'm one of John's patients. I'm a college student in this area. I've always wondered when people get sick on campus, how long they're actually contagious for.
Lysol for the win. Hey guys, John here, and all kidding aside, Izzy has a great question. Izzy wants to know when she gets sick, or all of her friends on campus get sick, how long are they actually contagious for? I think it's a really good question, and I think viruses are worth talking about, especially considering we're coming at the tail end of our winter months, those cold months where sickness is rampant, some sort of infection, something's always going around, and everybody feels like, I don't want to get sick before the holidays. So let's talk a little bit about viruses. What are viruses? Why are they more prevalent or seen more prevalent in the colder winter months? What are the symptoms and different types of symptoms you can get with the virus, what they mean, and then basically what you can do for them and how long you're contagious for, all right? So a virus, well, first of all, Izzy, thanks for asking the question. A virus is an organism that will enter your body and then start to replicate or reproduce, and then it will cause an infection inside your body. The type of virus dictates what kind of infection you're gonna have. There are different viruses, and so you'll have different types of sicknesses. We're really familiar with the common cold, right? What we know as a head cold, right? Those symptoms that we feel like we can never get rid of that almost everybody has can relate to one way or another. So common cold is kind of a garbage term. There's actually a few types of viruses that are going to go around that are going to be really, really similar in presentation. And even though they're different, we kind of lump them together. Some of them are going to be a little bit more severe, like the flu. And then you have something like COVID or coronavirus, which turned into something really, really aggressive and completely different than a lot of what we've seen in the past. So let's talk about that a little bit. Different types of viruses, like coronavirus is a big one. Influenza, RSV is a respiratory virus, something that affects your respiratory system. Adenovirus, rhinovirus. Those are a few different types of really, really common viruses that we're going to experience in our everyday life. All right? And the reason we experience them a lot in the colder winter months is because it's easier for the viruses to replicate and live and exist in colder, drier temperatures. The viruses will live a lot longer in colder, drier climates than they will in hot, humid climates. And so we turn on the heat in the house and all of a sudden the air gets dried out. The humidity drops outside in the winter months. We also spend more time close indoors during winter months. And so there's a greater chance that you're going to be near somebody you can communicate something if you're contagious or get something from somebody else who's contagious. So that's one of the reasons that the winter months are the months where it's really common to get sick. And then those viruses that I just listed, I'm not going to get into specifics here. We don't have to go that deep, but they're the ones that are more common that are going to cause very similar symptoms. So what are those symptoms? Well, the symptom patterns that we're going to get for the really common viruses are classified as either upper respiratory, lower respiratory, digestive, or flu-like symptoms. We say flu-like because even though there's going to be similar symptoms to other ones, it's in a category in and of itself. It's just usually a little bit more severe and more aggressive for some people. So flu-like symptoms are going to be fever, chills, shortness of breath, severe fatigue, things like that. A lot of body aches. You're going to have like no energy whatsoever. So that's the flu. Upper respiratory issues are going to be what most of us know as their sore throat, stuffy nose, runny nose, headache, a little bit of a fever maybe. That cough is going to be a dry cough. You just feel like it relents and it just never goes away for weeks and weeks. That's an upper respiratory tract infection, and that's usually from the neck up, all right? We call that a head cold. Those are usually mild, but it can turn into something more severe, or a completely different virus altogether can give you a lower respiratory tract infection. Lower respiratory tract infections affect your respiratory system in your lungs and chest, all right? So symptoms there are gonna be wheezing, coughing, that wet, mucousy, productive cough, hacking up a lung kind of thing. You're gonna have shortness of breath, you can have chest tightness, you can be sneezing. So those are the ones that really kind of are classic of a lower respiratory tract infection. Those are generally a little bit more severe. Sometimes they require a little bit more medical management, whereas the upper ones can be dealt with rest and maybe some cold medication that you get from the pharmacy or something at home. Now keep in mind, this is not medical advice, all right? Disclaimer, I'm not giving medical advice. If you're sick, you need to go get checked out. Is that good enough, Justin? Is that a good disclaimer? Maybe you should ask your dad. So lower respiratory tract infections can be a little bit more severe, especially for the elderly population or young population, or the population of individuals who are sick to begin with, if they have an underlying immune system issue or immune system compromise. So those are the differences between upper respiratory, lower respiratory. And then you can have digestive viruses, something like a stomach bug, norovirus on those cruise ships, those big outbreaks, food poisoning. Those are all different types of issues that can cause digestive symptoms such as nausea, diarrhea, vomiting, and double points if you can spell diarrhea without having to look it up. Justin or Meg will tell you what prize you won. So those are the different types of symptoms. You can have flu-like symptoms, upper respiratory symptoms, lower respiratory symptoms, or digestive symptoms. All right. So these are the 4 different common symptom presentations for those common viruses that we're all going to experience during those cold winter months. So now what do we do about that? How do you actually get better? Well, a virus really just needs to run its course. There are antiviral medications that you can prescribe in severe circumstances, but most of the time with really mild symptoms and mild viruses, you just need to let your body rest. Rest is the best thing you can do. Lots of sleep, lots of fluids, keep food and calories in your body, and you really just don't want to overexert yourself or stress yourself out. You want to allow your body to fight that virus to the point where you actually kill it, and then you can move on, okay? Now, sometimes that can last for a few weeks. Sometimes it could be a few days. The shorter your symptom pattern and presentation, you could probably get back into your activity a little bit quicker, especially if you're looking to, do sports or just go to the gym or go back to work, and if you have a really demanding job or things like that. The longer you're out, if you have like a lower respiratory issue or that cough that's lingering or that fatigue that's lasting forever, if you get the flu, it can really knock you out for a little bit. And so that may take you a little bit longer to ramp back up to your other activities. The longer you're out, plan on a longer ramp up back into your activities and demands that you normally experience in your weekly or daily lives. If the symptoms are mild, we go by like the neck rule for symptoms, because people ask us, when can I get back to exercise? When can I get back to running? First thing we always say is if you can go up and down a flight of stairs a couple times without being short of breath or really getting knocked out, you could probably go out for a walk. Start going for a walk, and as long as your symptoms stay above the level of your neck, right? Meaning if you still have a runny nose, you get a little headache, that's fine, your sore throat's there, that's okay. You can stay at like a moderate intensity effort or a low intensity effort, and just to get your blood flowing a little bit, get your heart rate up a little, and just feel like you're getting some fresh air doing something. If, however, your symptoms progress to go below your neck, you start to get short of breath, you start to get chest tightness, you start to wheeze or cough with the more aggressive the activity or the longer that you're doing something, that means your body's not ready to get back to activity yet. So that's something really important to take into consideration. If your symptoms stay above your neck, you can continue to work out. If they progress a little lower and you get worse, well, then you should probably just rest a little bit more. More sleep, more fluids, more food, chill out. The last thing I want to talk about is, well, how long are you contagious for? Well, aside from the digestive ones, we're going to lump all the other viruses together because they're common and there is some overlap. But like anything else, it depends, and there's no clear consensus. What we do know is that you're contagious the first few days before you experience symptoms and for up to 2 weeks after your symptoms start. That's actually a big range, which is why these things spread so easily, because you can be symptomatic for 1 to 3 or 4 days before you can be contagious for up to 4 days before you actually have any symptoms. Your body can be shedding that virus because it's already inside you. Now, how long you can be contagious for afterwards? Well, up to 2 weeks after you even get symptoms. So that's where this becomes a really, tricky suggestion where, well, we just need to really do our best. And that's where they have all these, recommendations of, wash your hands, wear a mask if you need to, you can limit the spread, stay away from people if you feel like you're getting sick. So aside from staying healthy in general, once you become symptomatic, that's where you really need to think a little bit more. So things like the stomach bug, stomach flu, any kind of digestive issues, well, those are a little less. Those are a little bit more progressive and fast too. You may only be symptomatic or contagious for a couple days before you get symptoms, and only a couple days after you have the symptoms as well. So they usually fly through you really, really quickly. All in all, guys, that's kind of the long and short of viruses, what a virus actually is and when you're contagious and what the symptoms mean. Again, if you're experiencing any kind of symptoms, you should definitely get checked out if you're concerned. But upper respiratory infections from a virus tend to be a little bit more mild. Lower respiratory ones tend to be a little bit more aggressive, and they're going to have very different symptoms. And you're going to want to stay on top of that. Certainly don't push it when you have those. And then you have ones like digestive issues, which is, well, I hope we never get those. Those are in a different class of their own. And then the flu. We talk about the flu every fall, once flu season comes around. So different presentations there. But these are all viruses, types of viruses, and only some of the ones that are out there. But they're certainly the more common ones. So Izzy, thanks for your question. Just make sure you guys, stay well hydrated and get lots of rest, because when your body's run down, you are more susceptible to getting sick. This is also why there's that myth that the cold causes flu or cold causes sickness. It doesn't. The cold doesn't cause anything. The cold sometimes make you more susceptible to getting something, and the virus is already out there in the colder, drier weather. So the wet hair in the cold does not make you get sick. During the winter, you're just at a greater risk of getting sick for other reasons in general. So thanks for the question. Hope you guys enjoyed the content. If you have any other questions, let us know. Otherwise, see you next time.